All right, hello everyone. We're about to get started now. I want to thank you for joining us for our webinar, Putting Pain Relief in Your Hands with Dr. Jeff Foucrier. This webinar is being presented by Heart of Wellness. We are a collaborative practice based in Olympia, Washington, dedicated to healing the whole of you. I'm Holly Reed, a patient care coordinator. You may recognize me from the front desk. I also serve as part of the marketing team. Heart of Wellness is a naturopathic based clinic with 7 naturopathic doctors, as well as 6 specialty clinicians in the areas of acupuncture, nutrition, massage therapy, and of course, physical therapy. Our physical therapy department started up in May and has been serving patients of all ages and needs. And we're very happy to have them on board. Currently, we do offer in-office appointments for physical therapy, as well as new telehealth options for returning physical therapy concerns that have already been addressed with our physical therapists. Today's presentation, again, is brought to you by Dr. Jeff Foucrier, one of our skilled physical therapists. He's board certified specialty in orthopedics and has training in myofascial trigger points. Using his skills and training, Jeff is able to identify areas that have resisted the body's natural ability to heal, and chronic pain is one of those conditions. He also has a variety of other skills and specialties. He focuses in other areas, including headaches, jaw pains, TMJ disorder, neck and spinal pain. Jeff has presented other webinars, which are available on our website, as well as this webinar, which will be available on our website in the next couple of days. So without further ado, please put your hands metaphorically together for Jeff Foucrier.
Thank you for the introduction, Holly, and welcome everybody. I'm actually really excited. This is a great group. So I'm hoping that we will have some good interactions today. One of the things I want to start off with is when referring to me, you can go ahead and refer to me as Jeff. That's perfectly fine. I will take questions throughout the webinar. However, if you do have a question, I ask that you type it. Holly will be helping me with that as well. If I can't answer your question at that point in time, I will get back to it as the presentation continues. I would ask that all participants please keep themselves muted, just so that, again, as I go through the material, it doesn't distract or detract from others participating. As with any presentation, I feel we have to have some disclaimers. The first disclaimer for this presentation is that I will not be providing any personal medical advice or care during today's webinar. All right, so I'll just be giving some overarching themes, theories, as well as techniques that any one person can utilize, as well as a few of the things that I do use myself in clinical practice. As another disclaimer, the content of this presentation is for individuals that are suffering from persistent chronic pain. And I know that's kind of redundant, persistent and chronic, but those individuals that have pain that lasts for long periods of time. If you have yourself or someone you know has experienced an atypical, so not normal increase in symptoms or progression in symptoms, please contact your health provider first, as this information is not necessarily going to be relevant. So as Holly had mentioned, I'm going to go ahead and dive right into the title, which is Putting Pain Relief in Your Hands. One of the things not mentioned is by Holly is that I do have some years that I taught in higher education. So of course, with any lecture I do have, I have to have objectives. So here they are. By the end of this presentation, I am hoping that each of you will be able to describe the difference between acute and chronic pain, be able to recall the general rules of pain. Again, that will be covered today in our webinar. Understand the mind-body connection of pain. This is going to be a very superficial introduction into the mind-body connection, as well as an act that you'll be able to act on the first 3 steps to managing your pain. One of the things that I do want to point out, though, before we continue, I want to make sure everybody knows how to access the chat bar or chat menu, as I will be asking asking people to type messages in, and it's also just handy if you have a question. If you go down to the banner on the Zoom platform, there should be a little chat icon, which is a bubble. All you're gonna need to do is click that. It'll pull up the chat, and you can go ahead and enter your text into the box that becomes that pops up. If you do have questions with that, please don't hesitate to let me know. And again, for anybody that needs to jump in and out of the webinar, perfectly fine. This is recorded, and you'll be able to access it anytime. So when we start talking or speaking to chronic pain, I'm wondering if this is you, if you do experience this, or someone else that you know experiences this. Do you have back pain that doesn't respond to injections? Those are generally corticosteroid injections. Do you have headaches that don't respond to muscle relaxers? Do you have hip and pelvic pain that can't be identified? Do you have neck pain that isn't managed with over-the-counter pain medications? Maybe you have a shoulder injury that has healed, but you continue to have pain. Or you have a diagnosis of fibromyalgia. These are very common presentations that I see within the clinic with regards to chronic pain. And the information that I will be referring to, or at least the content that I'll be covering, will be applicable to a large number of different diagnoses, including things like osteoarthritis as well as rheumatoid arthritis. So if anyone's curious about that, yes, this will apply to those types of conditions. Now, I really want to get a good idea of where everybody sits with the idea of pain. And so this is an activity that I would like you to participate in, hence why I spoke briefly about how to use the chat function. If you can, very briefly, pull up the chat, and I want you to type in your own words what you think pain is. And yes, we're doing that right now. Go ahead and type away. I will wait until I get some responses. Yes. Oh, good answers already. I love this. Okay. Some have very technical descriptions and definitions. Others talk about a function. I love this. This is really, really great. Yeah. All right. So just going through all of the different, I guess, descriptions you have, or words for pain. Debilitating. That can mean a lot. It could refer to function. It could return to mental state. It could emotional state. Pain is stupid. You know, that is such an interesting comment. And we're going to get to that in a little bit, because I think pain is absolutely stupid in the fact that it does impact us so much, but it is quite amazing in why we have it and why our body uses it the way that it does. Yes, pain is more than just physical. Pain could be mental or spiritual. As a matter of fact, when you start thinking about or looking at the definition of pain, oftentimes the word physical isn't included in the definition. And that's because pain transcends our physical body. Oftentimes it's defined as being just an uncomfortable sensation that we have, whether that be mental, spiritual, or physical. And there are many different types of pain. Absolutely. When we start talking about how we qualify pain, it could be sharp, aching, sore, it could be burning, electrical. And in some cases, there are quantifiable ways that we can temporarily categorize pain. That is, it may be short, it may be long. And that's actually what the medical community really utilizes in order to define what type of pain someone has. Yes, it might be for the quality, but it's also defined by either acute or chronic. Now, when we start talking about pain, and I'm just going to be talking from pain right now, as I would as a clinician. So pain, first of all, is an uncomfortable sensation. Acute pain is a type of pain that we know the general cause for, all right? It's relatively short in duration, and it's associated with healing times. What that means is that you get a cut on your forearm and you wait 7 to 10 days until that cut kind of heals over itself, not completely recovered. But you'll notice in that period of time that pain decreases as the body heals. That is generally associated with an acute pain presentation. And finally, symptoms subside when underlying conditions or the injury is treated or healed. Again, that is acute pain. Now, chronic pain, as to the title of this presentation, is often unknown as far as what causes it. Sometimes symptoms can persist after healing has already taken place. And what that means is that you may have had an injury at some time and you continue to have that pain even though everyone's told you that it's healed. And with someone that does suffer from chronic pain, symptoms are generally managed. And by the definition, there is no cure. That is, there is no way to take a pill, let's say, and resolve whatever it is that you are experiencing. And this actually is one of the biggest barriers in our current medical system, is that we're trying to always look for this one solution, this one thing that's going to change our current presentation of pain. Now, with these things in mind, I've done a lot of reading about neuroscience, as well as the physiological changes that happen to the body and the brain when we have pain. But there are a few things that I really want to pull out. We have those definitions that we just covered. But for you, this is what I want you to remember about pain. Pain is about protection. All right? Pain is there for a reason. Pain does not actually indicate the condition of your body. And I think this is what perplexes many practitioners, is that someone says that they're in pain, and they are in pain. But the physician or clinician, whoever it is that's treating them, can't necessarily pinpoint what is causing it. Or, well, hey, it does seem that you have this going on in your body, and it seems to directly relate to your pain. That isn't always the case. And I want to reiterate this point, that pain is a normal phenomenon. That means that we all experience pain, and it is there for a reason. Generally speaking, what most people would tell you is that the body is telling you that there is an injury. For those individuals that have chronic pain, there may be no injury, but the body still perceives that there is an injury, and it's trying to protect you. In other words, your pain does not mean you have tissue damage. It could, in fact, just be a leftover of some other process. One of the things, though, that this really does highlight is that there is another component about pain that I believe often goes overlooked. And that is that the reign of pain is mainly in the brain. This is by no means stating that pain is psychological. It can be. It absolutely can be psychological. But what this is referring to is that pain is a neurological process. For those that are not familiar with neurology or the nervous system, it is a system in our body that basically is the communication network for how one part of the body talks or speaks with another part. It's also how information is relayed. When we suffer trauma, let's say an injury or a fall as a type of injury, we have trauma or damage to local tissue. The way that our brain knows that something's happened there are there nerves that send information to the brain and tells us basically that something's happened there. Well, let's say that tissue heals, and the nervous system in the brain is still telling you that there's an injury there. That process, that change, that physiological state is a neurological state and no longer muscle or bone. So pain, in truth, is a direct product of actions of the nervous system and the brain together. And it's not simple. It's not simple. It is very complicated. Most of us think, and I'm going to use these drawings, I hope I could do this well. Most of us think, and I'm hoping you can see my mouse here, that when we have a stimulus, let's say this is a bell right here, okay? And this bell, whenever we ring that bell, we have pain, all right? And these are nerves that are connected to the bell. And these arrows go up to the brain. We generally think, well, if I have a painful stimulus, let's say someone touches my arm and that little bell is being rung here in my forearm, and the signal is being shot up to my brain. Most of us think, well, gosh, I mean, there's a pretty direct relationship between this bell and the brain. That is, in fact, not the case. Pain is so much more complicated than that, because when we, in reality, what happens is closer to the right side. When we ring one bell, there are a lot of bells around this area that go off. And yes, we may have a common nerve that feeds information to our central nervous system from that spot. But then everything connected to that nervous system and sometimes other parts of the body also start getting turned on. And that's why someone, let's say with neck pain, where they have pain right here, start to have pain in the front of their face. It's because some of the nerves in the back of the head actually connect with the major nerve that gives us sensation to our face. So when we have this nerve turn on in the back, it'll turn pain on in the face as well. Now that's just from a sensory standpoint. What happens in the actual brain? Well, again, many of us think that if we have one lesion, which is an injury to tissue here, and I'm sorry for the poor quality, that will lead to the spinal cord, and this is a cross section of the spinal cord here, and then it'll lead up to one small point in the brain that tells us, hey, you have pain here. Yeah, no, it's not that simple. What actually happens, and what we've seen with studies, neurological studies, is that we get that one injury in the one part of the body, it goes to the central cord, but then it activates dozens, if not hundreds of different places in our brain. And that really leads to a very complex relationship with pain. We're going to discuss the complexity of that a little later as it really pertains to the individual experience with pain. Pain can be tied to a lot of different things, including memory, sight, smell, taste. And so consequently, different parts of the brain will be activated whenever we do have pain. There's another element of the nervous system that I think is worthwhile to discuss. And I do discuss this with some of my patients regarding what happens over time when these pathways here are activated. So if we ring this bell once and it causes a pain response, generally speaking, the body recovers. The nervous system does, they say. Now, what happens though if we continue to ring that bell over and over and over and over and over again? Well, believe it or not, when we start utilizing those nerves in that way, the body actually creates a stronger impulse and a faster reaction in that nervous system, such that it's easier to be in a state of pain with very, very little stimulus. You don't need much to actually ring the bell anymore. As a matter of fact, someone like passes by the bell and it stimulates that pain response along with everything that comes with it. I like to use the analogy of a road where you have ruts and you have this cart that rolls down this road consistently all day long. Well, the more that cart travels down that road, the more likely it is it's going to create ruts in the ground. Over time, those ruts are going to get deeper and deeper and deeper. Now, the functional effect, of course, is that cart is going to have a heck of a time getting out of that road. It's not going to be able to break away. And something that's very similar can be said for the body. The body always travels the path of least resistance. That is what's easiest. And honestly, for the cart, it's easy to stay in that rut. And so for the nervous system, if you constantly stimulate that pain pathway, the body stays in that state because it's easy. Now, the chronic pain profile, it is complex. Going back to my original picture here of the brain and how pain can actually stimulate many different areas of the brain, this does change from person to person. Some of us have certain memories or emotions or thoughts associated with pain. And of course, for that specific presentation, that is going to be incredibly important for you to realize and to acknowledge. Others of us also have a physiological propensity for pain, including our chemistry and genetics. And really what I delve into a little more so is how that all interplays with movement. Movement is a way that we can both aggravate pain as well as alleviate it. But it's not that simple. As with pain itself, where we have a lot of memories and emotions associated with that, we also have a lot of memories and emotions associated with movement and pain. For many of my patients that do come in, there is a fear or anxiety associated with pain. I don't want to do something because it's going to cause me pain. That doing something is generally moving a certain way. All right, so with regards to physical therapy, a lot of my time is spent associated with this movement component, but everything else has to also, in some way or another, find its way into the plan of care that we provide. The mind-body connection. I think I've already touched on this kind of superficially, but the painful response that we experience isn't just a body presentation. As some of you have mentioned in your definitions, there's absolutely an emotional and mind effect. From a neurological standpoint, your pain profile will change not only your perception of pain, but your sense of space, even temperature sensitivity, and your touch tolerance. So again, a memory that you have or emotion of pain can immediately trigger a perception of pain. It may also change your sense of space. It may change temperature sensitivity or even your tolerance to someone touching you. I realize that I've gone through this material very, very quickly. But what I'm hoping you're starting to get here is a picture. And that picture is that when we start looking at pain, it isn't simple. It isn't simple. But there is an element here that I really want to highlight, and that is the individual. Each of you have a very different outlook or a different experience with pain, and that should be at the forefront of any plan of care that is developed. To this point, the first step to treating any chronic pain for any patient, I don't care who it has been in my experience, whether it be someone with fibromyalgia, whether it be someone with rheumatoid arthritis, whether it be someone that fell and broke their leg and has had debilitating pain for 10 years, someone with headaches, someone with postpartum abdominal pain. There are three things that I found to be extremely beneficial to start this process of recovery from pain, finding relief. First is knowledge of your pain. Second is self-awareness. And the last one is hope. For that first point, learning about pain, am I asking you to learn about pain? Yes, I am. I am asking you to learn, even at a superficial level, what pain is. Because going back to some of the things where we actually feel that pain is out to get us, for example, pain is stupid. I mean, that personifies pain. It gives pain almost a personhood, where they are purposely trying to change us or to limit us. But I think it's important to accept pain for what it is. It's a part of who we are. And if we can understand why we have pain in our own body, what it's there for, science as well as my own clinical practice has shown that it is a very, very therapeutic process. Now, some of you would love to have technical books. And so what I've done is I've provided two different technical books that will give you tons of nerdy things to delve into. David Butler's Explain Pain Supercharts. It's a great book for that. And then you also have the Therapeutic Neuroscience Education. I would say number one is more of a clinical clinician tool. Number three is much more of a theory science tool. Number two, which is Jan Mundo's The Headache Healer's Handbook, is fantastic. It's a great resource. And while it does say headache, I have utilized pretty much everything that Jan does talk about in her book for my patients that do suffer from chronic pain very effectively. Or for those of you like, I don't like books, that's fair. Here are some videos you can watch, which I find to be very, very helpful. All right, so talking about awareness. Awareness in part is reconnecting with your pain. When did your symptoms start? Did they follow a specific event, physical or emotional or mental change in your life? How have they changed? And what I mean by that is when they first started, even if you don't remember, do you have a sense for how they've changed over time? And in relation to what? Okay. What makes your symptoms better? What makes your symptoms worse? To these points, I have had patients that have come in and told me, Jeff, my pain never goes away. It never goes away. It is always there. But there almost always is something that makes it worse. Always. The important component, the important piece I'd like to draw out from this is that we want to track changes. We want to track these symptoms. So if you haven't done this now and you're still on this pain journey, I ask you to start a journal. I have my patients do this where they actually track from a day-to-day basis what they're experiencing and when. That helps not only them start to see the relationship between their pain and movement, because that's what I really specialize in, but it may also bring to the forefront some things that they did not notice. Maybe first thing in the morning, they have anxiety associated with their job, or they have anxiety associated with anything within the house that they need to manage. And all of a sudden they see a spike in symptoms. That is incredibly important, not only for you, but also for me, because that might help direct me towards someone who might be able to help you with your anxiety. So be aware of your symptoms and track your changes. You aren't alone. This is partly associated with that hope component. There are people out there who can help with pain. And the interesting thing is that, again, I have had patients come in and tell me they've given up. They have no hope. The interesting thing is that when a patient comes in to see me, right, and they tell me they don't have hope, the act of coming to see me, that's actually driven from hope. That person is trying to find a solution. And yes, it may be a last-ditch effort to go see, of all people, a physical therapist. I really want to capitalize on that hope piece. And that really does transfer over to compliance. If you don't believe that your symptoms will get better, I hate to tell you that it probably won't. However, if you do believe that there is a solution, that puts you so far ahead in your ability to manage your pain and actually find relief, as compared to someone who doesn't necessarily know whether or not they actually can find it. Finding someone to actually listen to you, I think has been one of the most powerful tools my patients have told me about in the past. And that is absolutely an avenue through which hope can be not only rekindled, but reinforced. All right, I have an activity here because who wants to hear me continue talking? I really want to hone in on this idea between movement and pain, and this mind-body connection and how they're intimately connected. Take someone who has back pain, okay? What position, and this is a question to all of you that you can type down, what position do you think someone falls into when they have back pain? What do they physically do when they have back pain? Can you describe that to me? They brace themselves. Yes, they do. Oh, do they? Depending on where it is. How do they brace themselves? They don't stand up straight and they stop moving. Love it. Absolutely. They stiffen up. Yep. Typically speaking, and again, I'm using this, absolutely get that tension of their muscles too. I'm going to stand up here so you can see me. But the position of pain is generally here. They generally stand in a position where they are guarded. They close themselves down. They bend forward. They do that in order to do everything you have mentioned, to stop moving. They don't want to stand. They may not be able to find a position that's comfortable. And so they assume a position that limits movement. Now, what's interesting is that even in the instance when the back has healed, they've gone to the physician, I have back pain, I have back pain. Well, we've done x-rays, we've done everything, and everything seems fine. You know what? This all seems to be in your head. The truth of the matter, you can tell the physician, yes, it is in my head because my neurology has changed. But it's more than that. Now, whenever that person is in pain, they fall into a posture of protection. This activity here is a form of biofeedback, and I'm going to take you through it really quickly. The activity is called always versus never. Let's take our patient with back pain, and I want you to envision this. You have back pain, or you have any pain that you currently have, and you're going to tell yourself, I am always going to have pain. I am always going to have limitations in my movement. I am not getting any better with this care. I'm always, always, always going to have my symptoms, and there's not going to be any relief. What happens to your body when you say those types of things? Did anyone, was anybody aware of that? You feel shut down. You got more slouchy. Yes, exactly. Yes, yes, you feel defeated. And what's that defeated posture? That defeated posture is this position. And it's deflating a happy heart. But there is a direct relationship between that happy heart, Christine, and your body posture. Now on the other hand, let's talk about never. Let's do this. You have your back pain, but you tell yourself, I am never going to be in pain. I am never going to have to stop what I love doing. I have found a solution or at least relief of symptoms. Never replace that pain. What happens to your was trying to make that such a very cool comment. I'm going to go ahead and turn off my video real quick. All right. Can everyone hear me? I turn. Yeah. Okay. Good. See my video off. What I was trying to get at is that when we use a different type of outlook associated with we tell ourselves, start back with always. Sorry, what is that? Always? You want me to start back at always? Okay, I'm still cutting out a little bit. What I'm going to have, video is off. I'm hoping that will clear here in a little bit. I'll try to make sure that I have my major points. When we speak to ourselves, if we practice positive mindset and relate that to good posture and movement patterns, what we'll find over time that body and our world will work in tandem. I won't necessarily have to tell myself that I'm in because I'll be able to put my in a posture that represents that state, that mind state. Okay. I will also be able to revert certain postures that drive painful reactions. This is in part, yeah, so my words are still not coming through, huh? Well, I hope that we recorded. I do apologize for these, that you can't necessarily hear me very well. Let's go ahead and move on to the second step. So that first step we talked about being aware, knowing what pain is, and of course, finding hope. Step, really starting to discover how that pain can be impacted on a day-to-day basis through normal activities. That changes to diet, exercise, stress management, and sleep. Now, this is very important because regardless of who you are, these 4 things are going to impact your pain cycle. Not only just your pain cycle, but of course your perception of pain. If you can work on these 4 things, there is a very good chance that you're going to start seeing relief in your symptoms just from the start. And luckily at Heart of Wellness, we do have specialists who can help you with these different things. We do have a nutritionist dietitian on staff. You, of course, have your different naturopaths and acupuncturists who can help you with stress management, exercise through physical therapy, and of course, collaboratively, we can also help with sleep. So the takeaway is this: through cause and effect, the process of self-care is the treatment. Now, this seems like just a bunch of words, but what this is effectively saying is that by listening to yourself, by becoming more aware of what your body is telling you, and acting on that, and in turn, doing it in such a way that you feel you are taking care of yourself, being good to yourself, that is one part of the treatment, and really the most important piece. And that is progressed and enhanced through the different interventions we do offer at Heart of Wellness. Now, I do apologize about the internet connection. I'm still hoping that some of you were able to get some valuable information. I do encourage anyone to reach out to me if you have specific questions about topics that perhaps I didn't necessarily delve into as deeply as you would like, and or maybe the internet prevented us from communicating well. But at this time, I would like to open up I guess the line to questions if anybody does have some. I'm going to turn my internet back on, or I'm sorry, my video. So please go ahead and send me some questions. I think at this point, if you could type them in, it would be easy. Yes, Christine, I can absolutely review that part. Let's go ahead and do that, because I think that's when everybody cut out, or I cut out. I don't know, doesn't matter. Let's go back to it. So as a quick review, yeah, we'll talk about that, Patricia. Thank you for bringing that up. The always component is that negative reinforcement, effectively. That's what always refers to. The never is that more positive reinforcement, but it's more than that. If I tell myself I am never going to be in pain, I am never going to have to stop doing what I love, I have found resolution or relief, and I'm never going to have to go back to that place of pain, you have to almost do an exercise where you take yourself and you look at your body's response to that. As we did with always, where you feel defeated and we kind of collapse. What you're going to find when you have that positive reinforcement is that your body assumes a better posture. It falls into a position where there's less stress, especially towards the areas that you have a tendency to overload or to stress yourself. It is a form of biofeedback. And what I mean by that is that by going through this exercise, by telling you you're never in that state, you're never going to be in pain again, and falling into a position you feel comfortable with, where you have reduced pain, you can reduce your fear of action, because that in and of itself gives you a place to start. Oftentimes in care, what I will do is I will start where someone is good, and I use the word good as in quotations, mainly to mean you feel safest in that position. From that safe place of movement, we can do quite a bit. For some of my patients that's lying on their back, that's fine. As long as you're able to be there relatively comfortably, we're going to optimize your movement in that position. And then guess what we're going to do? You love to dance? We're going to do different dance moves while you're lying on your back. And we'll throw in TheraBands, we'll throw in physio balls, all while making sure that we are very mindful of what happens to your symptoms. And if your symptoms do increase, we have the conversation together about what that means. It's your body saying that, there's a threat happening right now, but we both know that that's not the case. So we have this constant cycle of telling us that if everything is okay while we're doing something active, that repeated process, going back to this idea of the ruts in the road, will eventually change the ruts away from this perpetual pain cycle to one of function, where your body will fall into more, no, everything is okay. I am never going to be in that state of pain again, and we are going to find relief. This activity, this always versus never activity, is a very, very nice start to reconceptualizing the idea of movement and pain. All right, we have some other questions here. But before I continue, Christine, did I cover that well enough? You're very welcome. Okay, we got some other questions here. What role does trigger point injections play in treating chronic pain? Oh, what a fantastic question. Okay, so there are a lot of different theories out there associated with trigger point injection. The idea behind trigger point injections from a Western standpoint is that, generally speaking, some sort of chemical is being introduced into the system in order to change sensitivity of the nervous system. Now, this is done oftentimes with the use of a corticosteroid, which effectively removes the inflammation from an area. The inflammation locally causes a lot of chemical irritation and actually turns things on as it's supposed to. But in cases of chronic conditions, the presence of inflammation can actually magnify what is actually happening, okay? Trigger point injection is, the idea behind it is to get rid of the inflammation locally to decrease local chemical irritation in the muscle and the associated nerves. So when treating chronic pain, this is a more, I would say, musculoskeletal treatment, to be quite honest with you, associated with trigger point injections. Now, there are other types of injections, ones that, let's say, are more nerve root based, that are used to treat the nerve directly. But at a superficial level, Patricia, that is the role that trigger point injections play. That is, if there's an inflammatory process, it will treat that. So Debbie, what is the very first step to start with? There are so many things, you're right. And I did give you quite a bit. I would say that the first thing I would like you to start doing is to start reading about pain. That would be the first step. And the reason is because I want all of my patients to get away from this idea of that pain is evil. That pain is purposely there just to ruin your day and ruin your life. It is not. If you can understand why it is in your body and why perhaps you may be experiencing it, that's where I would start. So that's a great question. All right, what sorts of exercises can be better for chronic pain? Ooh, that is a good question. Wow, you know, that is one I would say that is dependent on the patient for the most part. Now, the reason I say that is because exercise in general has been found through the literature to be helpful for pain. For someone that has lower levels of pain that is persistent, you're generally going to want to do exercises that are more intense just because you can tolerate it. The overarching rule really with exercise is to do as much as possible without making symptoms worse. And that's because you want to maximize function as much as you possibly can. As far as literature, and I think to your question is, what has been proven to reduce pain? Nothing has been consistently proven to reduce pain better than anything else at this point, I would say. General movement absolutely has been. Stretching has been found to help. Walking in general can. Even strength training has been found to reduce pain. It really has to do with what type of presentation you have. And this actually would be a question and a plan that you would develop, let's say, with someone like me to see what is going to work best for you. Because what might be great for someone with fibromyalgia, where they do a lot of, let's say, cardio training, they wouldn't necessarily tolerate strength training. So we would need to develop it towards what that person actually presents with. Even if you've been told your condition is progressive and have ongoing changes in abilities, is it helpful to do the always exercise? What if you have very few exercises available to you? Even if you've been told your condition is progressive and have ongoing changes in abilities. Yes. Yes, it is still helpful to do the always exercise, because in that point in time, that positive mindset, that always attitude, okay? I'm sorry, the always is associated with negative. Sorry. The negative attitude is going to bring you down. it is going to hamper and inhibit your function. Having that positive mindset is going to be is very important. And what if you have very few exercises available to you? There are infinite number of movements that we can provide or perform through the body. If you can't necessarily find a way that's doable in your given condition, what things can you change or modify in order to improve that exercise or to enhance or increase the exercises available to you? That is a question that you would speak to a physical therapist about. How can we modify what you're doing on a daily basis so that you can get some therapeutic benefit while also meeting your functional goals? So if you have very few exercises, that's when you start reaching out to someone who has that experience to help you with that. Oh, Lisa, what a great question. Well, don't corticosteroids cause arthritis over time? Oh, what an interesting. So long-term use of corticosteroids, yes, actually does several things. It can degrade bone. It can also degrade fascial tissue and muscle tissue. Absolutely does. Now, as far as arthritis is concerned, I guess we do need to have a discussion about what arthritis means. Arthritis is technically inflammation in a joint. Now, if you're referring to the breakdown of tissue due to corticosteroids, that might not necessarily be associated with arthritis directly, but over time, it can cause wear and tear to the joints, and we would call that arthrosis. I know it's, it's just definitions, but that is important, and I hope you understand that a corticosteroid in itself will not cause the arthritis, but over time will degrade tissue, which could lead to changes in movement. Okay, another question. If you want to resume what you'd like to do prior to chronic pain, do you know ergonomic specialists to help set up a workplace and work in a way that doesn't create more pain? Yes, absolutely. So physical therapists, we are trained in ergonomic assessments. Ergonomic modifications to a work environment is important. And the reason it's important is because we talk about movement, not necessarily in terms of single movements, but repeated. You are doing something over and over and over and over again to such a point that the body starts to have wear and tear. You do that enough from day to day, what happens is that it causes a musculoskeletal change, which then in turn, through pain, will change the nervous system. And the nervous system will actually become more sensitized because of that. So yes, finding an ergonomic specialist is very important. So generally speaking, I would say you're going to find some good ergonomic specialists, either in physical therapists or occupational therapists. Most clinicians actually at Heart of Wellness will have some modifications they may make, but for more specific alterations, you want to speak to a PT or an OT. It's really hard to overcome the reality doctors expect that. That's going to be a big challenge. Yes, you're absolutely right. Unfortunately, this is a big challenge and barrier to a lot of the care that I do provide. Having a positive attitude and a positive mindset associated with not only body image, but also with pain is difficult, primarily because in a lot of Western practices, we look at pain as an indicator that something's wrong physically. And oftentimes it's a neurological issue. And in truth, the skill set needed in order to change pain from a neurological standpoint really sits outside of that internal medicine standpoint. I'm not saying that internal medicine isn't beneficial. It can be in certain situations. But pain, at least the management of pain, has been found to be much more changeable, I guess, without thinking of a synonym, through multimodal care. That means through the use of nutrition, from movement, from psychotherapy, from repeated exercises that actually transcend what we typically would put inside of our body. Supplementation can help, but should be used in conjunction with those other things: stress management, exercise, and sleep pattern improvement. I love the love here, people. I love the love. But you're right, and this is another piece that I would like everyone to know is that you're not. Many people are in a state of persistent pain. And again, whether that be physical, mental, or emotional, there are strategies, though. There are well-established strategies, whether it's in the literature or it's through science, that you'll be able to find some resolution. Ultimately, though, if you feel stuck, it may be worthwhile to have a conversation with a clinician. I myself have free visits, so 15 to 30-minute visits where we can sit and talk about what is going on and whether or not I feel physical therapy will help you. During that period of time, I will also tell my patients what I would suggest that they do, and at least to start that process in trying to find some sort of resolution to what is happening. Are there any other questions? TMS for chronic pain. I'm sorry for my, there are a lot of abbreviations. Can you tell me what TMS is for? And you can unmute yourself. I can do that for you if you can't.
Oh, the transmagnetic cranial stimulation seems to be getting a lot of press for fibromyalgia, resistant depression. Some people are saying chronic pain. What's your take on that?
Yes. My take on it is this. It is getting a lot of traction. I'm going to have to see what happens with more research and time. Typically speaking, when you're using this type of technology or this approach for treatment, it's kind of a last-ditch effort for many people that have chronic pain. My feeling on this is I would much rather use a little more conservative methodology or approaches before resorting to those types of treatments. But I think that for me, I would want to work with whatever clinician is providing those types of services to make sure that we have a multimodal approach, regardless of whether there is going to be some sort of magnetic implementation within the body, implants that is. I would like to see incorporated with other things, such as, again, diet modification, sleep modification, exercise modification, because in and of itself, that technology is not going to be sustainable. At least that has not been my experience. Does fibromyalgia ever go away? Oh, that's a good question, Bonnie. I think it depends on how we define go away. I think that individuals that do suffer from fibromyalgia may find relief, just as with headaches. An individual that has headaches has had headaches their entire life will probably have headaches, but to what extent will they actually limit their function? I think that for the most part, for my patients that do suffer from headaches, we work very hard on making sure they have a plan to help manage and prevent prophylactically the fibromyalgia from affecting them to such a point, or sorry, headaches, to such a point where they have restriction in their life. So I would say that I can't say it goes away, but it absolutely can be modified. I do have telemed sessions, John. I do, yes. Cranial sacral therapy for neck or jaw pain. Yes, I do have some experience working with cranial sacral therapy, specifically for jaw pain. I have found there to be successes. However, I will also say that it really depends on the patient, as with any kind of, so even going back to TMS, for example, for chronic pain, it's really going to be dependent on the patient. And that's what makes it so difficult, to be quite honest with you, and why I am so cautious in making these steps towards having surgery or implants, because you can't change that. But cranial sacral is a technique, a very light manual technique, where we can influence cranial sacral fluids within the body, particularly within the central cord, and that in turn can change neural sensitivity, right? Remember, pain's coming from the nervous system. If we can influence the nervous system through the fluid within the central cord, we can in turn affect pain. I've seen some success with it, but again, that hasn't always been the case. With any kind of pain, though, it's going to be very important to have a wide set of tools to try different things. And that's why I wouldn't necessarily want to restrict your plan of care to one thing only. We would have to try a multimodal approach, whether it be manual therapy, movement, breathing exercises, some forms of meditation, down regulation of your autonomic nervous system. And for those that don't know what that means, for those of us in pain, we're in a constant state of go, 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 right? It's kind of fight or flight. We want to find ways in order to help regulate that as well. How do I feel about anti-inflammatory meds in conjunction with other modalities? Yeah, so there are some side effects associated with anti-inflammatory meds. One of the things that I have to say in this video now is that in no way, shape, or form can I give any medical advice as far as pharmaceuticals. I want to make sure that's very clear. I can tell you what the science says, and I can tell you how it may impact you, but I cannot give you any specific guidance associated with a pharmaceutical. If your physician has prescribed it, I'm going to tell you to follow that prescription, period. If I feel like a medication is not good for a patient, I will have them follow up with their physician. How do I feel about anti-inflammatories? I have no problem with anti-inflammatories as long as it's being managed by a physician and or a primary care provider. I generally find the use of pain medication or supplements that help with pain or supplements that help with inflammation during the use or during the application of exercise to be very, very beneficial. Even in the short term, honestly, when it comes to movement, seeing as how movement, many forms, does help with pain, I want you to get you moving, period. So if I can get you in that moment to move better with any kind of supplement that helps with pain or inflammation, we're going to do it. So I think it's a very powerful use in a pain regimen. However, proper regulation of the pharmaceutical will have to be done by your primary care provider. Yeah, you're very welcome. I know we went up to 1 o'clock, but really great questions. I highly encourage any of you to reach out to me here at Heart and Wellness if you have further questions. It's been great. I've had a really good time. I will go ahead and just sit on just for another minute and then we'll close everything down. Yep, absolutely.